All right, guys. So it seems to me like there's a pretty good number of athletes out there now that have started to get into the habit of actually doing some soft tissue, muscle, fascial work on their own for maintenance purposes. I haven't necessarily seen a good resource for self treatment as far as that goes. And I'm hoping I can give you a few pointers that maybe you haven't quite picked up on yet. So first off, though, let me say that none of this should be considered as medical advice, and it's not necessarily geared towards an injured athlete or injured labor worker or whatever it might be. It is better for maintenance purposes. It may help with an injury, but I can't guarantee you that. And you could actually make your injury worse with some of these techniques if you don't know how to use them correctly. So I would just proceed with caution. Now, to start out with, your best location is going to be something like this here. I tend to do this kind of work on a rug. You could use a yoga mat, whatever it might be that is actually firm, but not directly on a hard floor. In general, you want to start out pretty conservatively if you've never done these kinds of things before. They could make you sore, most certainly, particularly if you've gone too aggressive with them. But how are you to know what too aggressive is if you've never done them before? So early on, you just want to keep the repetition numbers down, or the total time down on each area that you're actually trying to do some of the work to. So at first, I would suggest just trying to release or roll a single area one time in a day. Give it a couple days, see how you feel. If you don't get sore at all, fantastic. You might be able to do it every day. I wouldn't necessarily try to do more than once a day. Whatever's going to get done, it needs time. You're looking for maintenance here to try to prevent injury, not trying to cause yourself a new injury. Now, it shouldn't be surprising that some of this will be uncomfortable, but that tends to improve with time. And I say with time, meaning over 2 weeks to 4 weeks of pretty consistent work, you should be a little less tender, or a lot less tender, depending upon the area and how consistent you've been with it. It tends to be that some of the most tender areas are also the areas that need some of the most work. Now, that may mean there's some underlying problem that needs discovered. If an area is tender and tight, it may be borderline injured tissue, and something may be up with that tissue. It may not be withstanding whatever type of forces, whether it be running or weightlifting, whatever it might be. If you keep putting a demand on that tissue and it isn't adapting normally, then it could start to break down, and that's ultimately what we are trying to prevent here. Now, the one exception to the discomfort not necessarily worsening in that same day, but it should actually improve, is any of the steadier holding techniques. So with those, you want to put a steady pressure on the muscle, and you're holding that until the point that has become more of a pressure and less of a tender pain. So that could take 2 minutes, it could take 6 minutes, it could take 10 minutes. It depends upon the spot. So on some areas, you'll be about ready to give up, and then it'll finally give in. And that's a hard thing to learn if you've never done it before. So you may be better off just using some of the other just rolling, simpler techniques early on, and then progressing to some of the steadier holding techniques once you have a feel, and maybe once the muscles have broken down a little bit. They should release that way quicker anyhow. So with a beginner, somebody who's never done this kind of thing before, somebody who doesn't get massages, doesn't do foam rolling, whatever it might be, you could just do 10 repetitions or maybe 20 to 30 seconds of rolling across the full length of that muscle. If you're pretty advanced, you maybe have had a handful of massages, you get those more regularly, or if you do actually do some type of rolling, you're just looking for more specific advice on it, then maybe you could do 40 or 50 repetitions across the muscle, and you could keep rolling on that for 2 or 3 minutes. You know, that wouldn't be a bad thing for somebody who's used to it. The objective is, though, with a lot of these, is to actually generate a little bit of discomfort while you're doing them. So it is a little bit more like what a massage therapist would cause as far as a deep tissue type of work. So in order to do that, you might have to kind of shift your body weight different directions to add pressure onto whatever muscle it is that you're trying to work on. And when you do that, you may notice some occasional, what you call referral pain out of the muscle. And that would be okay. I tend to like folks to have that referral pain decrease with time, particularly if you're holding a pressure steady on that muscle. You'll get that referral pain. And then as the muscle relaxes, you tend to have less or completely are rid of that referral pain. Now you want to be really cautious, particularly at the back of the hip and down in the lower leg. You know, you have pretty big nerve structures there. So if you're feeling like your foot is tingling, for instance, you're probably putting some pressure on a nerve, and that's not really going to do you any good. So try to shy away from that. Another thing to keep in mind is that you do have other structures in there with those muscles, so you don't want to be too aggressive with it. You know, you've got the arteries and the veins, but particularly those nerves could be very sensitive to some of this work. So just be cautious, especially if you've never done any of these kinds of things before. So let's start out with just the basic foam roller. You can get these in much longer length. Yeah. If you're trying to do the hip, for instance, you're just looking for your 10 reps, your 20 reps of this. You could angle slightly differently to try to target some other tissues. But in general, that's what everybody thinks of when they think of foam rolling. So you could advance that with adding a stretch to the muscle that you're trying to roll. Tends to make it a little bit more intense, which is great if you're ready for that. The other thing is, like I was mentioning before, the steady pressure. So if you can find an area where maybe you are a little bit more tender back there, just keep a pressure on it until that area isn't so tender any longer. And again, that could take several minutes. So, you know, this arm, for instance, you got to be careful with because it's going to get very tiring. You could progress from that plain old foam roller to more of these textured rollers. If I was going to use a foam roller, I would probably favor that. There are also other rollers that have pipe inside of them to make them even stiffer. So they're less forgiving and maybe not necessarily geared towards a beginner so much. So again, you could go through the same exact repetitions. You could add stretch to it, or you could do that prolonged holding option. Now for the lower leg, I tend to really like the textured rollers if I was going to use a roller. You'll need to add pressure with your other leg. And this is the downfall to a foam roller, I think, at the lower leg, is you can really only work a small area at a time. So it's not very time friendly. It's not that bad, but essentially move from spot to spot in that instance. Doing your repetitions, and again, you could do the steady holding, doing more repetitions if you're more advanced. Now, another thing you could do, particularly with these ridges, is to find maybe a more problematic area that is more sore on you, and you could pump the foot up and down to try to break up some of that tissue. Or you could do side to side. It's going to depend upon what tissue it is, since each of those muscles has a different function in that lower leg. So again, you could do up or down, 10 or 20 repetitions. You do side to side. You do circles. Whatever it might be that catches your fancy there. I tend to like this roller a little more than either of those because it does have some adjustability to it. Now, I'm not going to put on my hip just a single narrow roller here, but certainly you could easily stack all of those together and do the hip work again, just as we had mentioned before. But I certainly, for the lower leg, like the fact that you can target some of the more irritable areas with those individual rollers. So you could do on that just the same, the active motion up and down. This also really starts to work well to target the tissues if you are going to do more of a steady holding technique. So just waiting on that tender area to release, which again could take several minutes. The other thing I tend to favor are just using a cross ball or tennis ball. So if you're going to use that on the hip, under the hip, just the weight of the body could be sufficient. Almost any time I do this, I start out that way, and it's almost always got a certain tenderness to it. But then as that goes, if I'm doing more of the steady pressure, I can go ahead and progress to that prolonged holding position and hold that until that releases, which tends to take even longer. And that is pretty uncomfortable. If you need to slack that off a little bit, certainly you can put the ball in the same area and just essentially lie down. You may need to even roll the hips over onto that a little bit to at least get enough pressure that it is tender. But then you are waiting and waiting and waiting, oftentimes multiple minutes, until eventually those muscles relax, in which case you're a happy camper at that point. Now, for the lower leg, I like using just a regular old chair. Get your ball on there. You could do the rolling again, just in general. But when you've gotten past that point and you need to be a little bit more specific with it, this is nice because the knee's bent. This outer calf muscle's on slack. You can just hold that there then. And if you're going to hold it, you might as well get comfortable and just kick back and relax and just let the ball do its magic. And again, you could do the up and down motion with this as well, or the side to side, whatever it might be, on those more problematic areas. And then lastly, we have the stick, which if you're going to do the lower leg, again, keeping the knee bent, you can just roll the entire length of the calf. So this is actually what I tend to favor when I'm working on my lower leg. And then if you wanted to even add a little bit of stretch, you could drop your heel and work on some of that tissue as well. So again, a beginner would be doing 10 to 20 repetitions up and down. Someone who's more advanced, your 40 or 50 repetitions. The stick's nice certainly too because it's a lot easier to transport. And there are even shorter versions of this. The stick does not work as well on the hip. I tend to not use it on that area at all. The one way you could actually use this for more of a steady holding technique would be to put a pressure with the end of the stick. But there's so many other devices that would do a better job than that I would tend to recommend those. So I hope this has been a little bit useful for you guys. If you have any questions, let me know.